All right, today we're going to be presenting you guys a healthcare professional burnout program. My name is Kellen Ungen, and you're going to be hearing from Tim Ammon and Landon Nielsen as well. So you might be wondering, what is burnout? Burnout is defined as a prolonged response to chronic emotional and interpersonal stressors, characterized by emotional exhaustion, depersonalization, and lack of social accomplishment. So the target population of this program is primarily in nurses, but it can be applied to most healthcare workers. Occupational burnout was first defined in 1974 by Freudenberger. Nurses represent the nation's largest healthcare profession with 3.8 million registered nurses nationwide. And burnout may affect 10 to 70% of nurses and 30 to 50% of physicians, nurse practitioners, and physician assistants. Nurses have one of the highest rates of burnout. And recently, in 2020 and 2021, burnout in healthcare workers has accelerated because of the COVID-19 outbreak. It's increased workload, job stress, time pressure, and limited organizational support. So just by doing a quick search, we are able to pull up a whole bunch of news articles that reports nurses going under severe stress and burnout. So what are the causes of burnout? Limited nurse autonomy. So nurses not being able to choose what they want to do and how they want to do it as much and having less control. Poor physician-nurse relationships. Poor control over nurse practice. Workload. Rewards. If the community is tight-knit. Fairness between younger and older generations of nurses. Values. And job person incongruity. Also, a poor nurse work environment.
All right. And before we can get our program started, we wanted to make sure that we had the appropriate needs assessment. And by doing that, we needed to have a needs assessment that was evidence-based. So therefore, we could increase the validity and reliability of our program. With that being said, we found in the literature that one of the systematic reviews found that the Maslach burnout inventory, otherwise known as the MBI, is the most commonly used tool to measure burnout. And also, as you can see at number 2, there's also subscales of the MBI, including the burnout measure and the Jerome-Malam burnout measure as well. All 3 of these look at outcome measures that usually focus around personal fatigue, cognitive weariness, and mental and emotional exhaustion. So so right here is just a screenshot of the Maslach burnout inventory, and this allows the individual to go through each question. And as you can see on the scale, has like 6 different choices they can make. And this way at the end, you can kind of add them all up and see where they are in terms of where they are for burnout. And like I said, there's different subsets, and this is just one little quick snapshot of the main Maslach burnout inventory, but just to give you guys a little visual of what it looks like. Okay. So right here is the risk factors. Like I said, in one of the literature that we came across, one of the articles mentioned, there's actually one in 2020 down there by DeHart and colleagues. They found that with healthcare worker burnout or just organizational burnout in general, that there's intrinsic factors and extrinsic factors. And a lot of the literature talks about intrinsic factors, and obviously they're very subjective. And these are the top 5 that they pulled from the literature, and just kind of going down the list, such as like suppressing own needs, feeling replaceable, work is only meaningful activity, work is a substitute for social life, and always wanting to please other people. And on the other side, you have extrinsic factors, basically what's happening within that individual's work environment. And the top 5 that were found in the literature were poor work organization, absence of social support, problems of leadership and collaboration, high demands at work, poor teamwork, internal communication. And I do want to add that with the recent development of the pandemic of COVID-19, these are probably only more exasperated, and therefore there could also be even more, just because of the complete change of just things going on within the work environment now. Okay. Now that we did a needs assessment and now we're able to develop the appropriate frames of reference, 2 that we came up with is PEO. And so obviously person, environment, and occupation fits perfectly with this. We kind of talked about like the intrinsic factors, and then the environment, of course, healthcare, and then the occupation itself. Um, this could go towards many different healthcare workers, but a lot of the literature did notice that nurses are at the highest risk. So to implement this program, that'd probably be the most appropriate healthcare professional would be nurses, since they're most at risk. And we also chose CPT, and that is because in a systematic review that included 17 studies, 13 of them examined the efficacy of psychosocial interventions of the reduction of burnout. And in the majority of those studies, cognitive behavioral therapy seemed to be have the biggest effect size for helping combat like emotional exhaustion. So that's one of the main reasons why we included CBT as well as one of our frames of reference. Okay. And with this, we have many different components that we are bringing into our program. As you can see, some of the interventions include mindfulness and relaxation training, promoting leisure activities within and without and outside of the work environment, nutrition, proper ergonomics, leadership training, and lastly, professional coaching for physicians.
So to start it off with mindfulness, as we've seen with a lot of different classes we've taken and things, that there's a lot of different ways you can practice mindfulness. And according to a study, mindfulness training reduces the emotional burden and hence levels of burnout among nurses. And so things that you can teach in the workplace are, mindfulness meditation, progressive muscle relaxation, yoga, some deep breathing exercises. So also our program focuses on promoting leisure activities, which we know is super important for, everyday lives. So the Mayo Clinic has inherited the Serious Leisure Perspective SLP, which combats patient stress and healthcare worker burnout through environmental modifications of workplace and incorporating leisure into their daily routines. And so with our program, we'd like to add leisure activities around the workplace, such as, pianos and other instruments, ping pong, gyms, basketball hoops, if we can, just so people have those resources available to them to use, in their free time. And, like Tim said earlier, we'll conduct a, COPM with, modified interest checklist just to identify what leisure activities people in the workplace like to do, so they can do on their breaks or while they're off on weekends, and, create a schedule of participation for the identified activities. Another big focus we have is exercise and nutrition. We all know that, there's plenty of studies out there that promote the efficacy of, these helping, be healthier and be happier. And so, some hospitals already do this, but they can provide gym membership assistance. Some hospitals actually have gyms and workout facilities in their hospital for the people who work there. You can use personal trainers to help set, achieve, and maintain goals, increase safety, increase stamina, strength, and cardiovascular health, but also provide nutritious option for lunches. It's good when, they only have a few minutes to go down to the cafeteria, that we make sure the cafeteria has some good nutritious lunches. And, we as OTs, we can advocate for that. Use health coaches, improve nutrition choices, provide shopping strategies, within the scope of practice of OT, and then create a reward program for participating in these activities.
All right. And one component of our program is proper ergonomics. As occupational therapists, we understand how important occupational engagement is. And with that being said, you can see on the left column, these are some of the questions as like we as OTs would be asking within a specific work environment in terms are the desks arranged to encourage good posture, and understanding the fact that they'll be taking phone calls daily, speaking to physicians, calling family members, and obviously we don't want them to be jeopardized in terms of poor body mechanics while being on the phone and typing within that workspace. Also, our desk at the right height. And so therefore, when we implement our program, we'll be modifying the environment with proper seating, so it's adjustable seat to floor heights. So they'll have different options for chairs. Also, we'll also advocate to the facility to invest in Bluetooth headsets. Like I said, so this way when incoming phone calls come in, they're not having to, kind of torque and manipulate their body in weird body postures. Also, with COVID coming in, it's probably safer that everybody has their own Bluetooth headset rather than sharing a community phone. And then also, we'll be modifying the environment to give healthcare workers the option to stand during documentation. You can have standing desks that allow you to adjust the height. So even if you want to sit or start, vice versa, and then also computer on wheels. This way, you can kind of bring that computer around with you all around, like the gym, for example, while you're documenting, and still being able to interact with your patients and still abiding by HIPAA regulations.
So leadership training. It all starts with the hiring process, where you want to make sure that you're hiring individuals that are going to fit in with the rest of your team. And you also want to make sure that during the hiring process, you're basically wanting to eliminate people quitting. So you want to make sure that they're going to be long-term employees, because it puts extra stress on the other teammates that are having to train and then retrain new employees constantly. We also, kind of like we talked about earlier, we want to make sure that leadership is implementing the inventory to make sure that they're seeing if people are getting burnt out. Because if you're tracking this, you're going to be able to put a stop to it and know when to implement the strategies and other interventions that we've already talked about. And leadership also needs to advocate for their employees. So a lot of the programs or interventions that we've talked about already, leadership can play a big role of helping increase access to those, like the gym memberships and nutrition coaches, ergonomic devices, and a whole bunch of other stuff. So a 2013 study of more than 2,800 physicians at Mayo Clinic found that each 1 point increase in the leadership score of the physician's immediate supervisor was associated with 3.3% decrease in the likelihood of burnout and a 9% increase in satisfaction for individual physicians after adjusting for age, sex, and specialty. So it's really important that leadership plays a role in this process.
So one study that we found was interesting, talked about professional coaching. And so they, basically said the implementation of an active, intensive communication strategy regarding end-of-life care in the ICU is associated with a significant reduction in the rate of burnout syndrome and depression in a stable population of caregiving staff, which, this particular study showed that these communication strategies could reduce the risk of severe burnout by 50%. And their communication strategies kind of revolved around, improving organization, better communication, and regular staff meetings. And especially, they talk about the triad of care between, the patient, the family, and then the caregivers. And that was kind of their focus. And we thought this was really impressive because this can be, applied in other situations, not just the ICU. So settings appropriate for this program, obviously hospitals, but skilled nursing facilities, outpatient clinics, inpatient clinics, home health, any healthcare facility really where there's a group atmosphere of different healthcare providers that have the potential for caregiver burnout. And here's our reference list.